So thank you everyone for joining, for all the people who are watching us on Facebook page, on our network, and all the people who are in our audience joining us on the Zoom link. My name is Anila Noor. I am founder of New Women Connectors and I'm co-founder of European Coalition. And this campaign we are just launching today. We are launching because as a living refugee woman in Europe, we feel everyone is talking about COVID. COVID changed so much, and we really want to save safe and stay informed. So this is the main purpose. We are bringing this campaign, Vaccine for all for vaccine, to make sure when we are talking about vaccine, we do not leave anyone behind. And we want for our communities who are from migration background, they have the access to all information. So the agenda is very short. It's only 1 hour because we are just launching. This is this event is the first event of so many events we want to do, but we want to do it, launch it with you. So thank you so much again. And for this event, we have two parts. First, we will ask our students, amazing students who help us a lot on a voluntary basis, who map different situation of migrant and refugees, but also the countries, how countries are responding to vaccine, how they're displaying this information. And that's why the first part will be vaccine for all. So we make sure how states in Europe, they are planning and introducing this vaccine in their countries. And second part, where we invited community leaders joining us from Spain, Denmark, Norway, Germany, and Italy, who are presenting and saying how these communities, if they have some kind of doubt, misinformation, and if they have some kind of unacceptance feelings about regarding this information, so is there right to ask this question: is this vaccine is healthy? Is this vaccine is appropriate, and is it good or not? So instead of stopping them, we need to provide them platform in their languages where they can understand and they ask this question. So let's start this event, and we have a very good students. So I will request our students first to introduce themselves, and then they have prepare a PowerPoint where they are mapping the situation of countries from Europe. And I will start and give floor to our students. So students who are just joining us from US University, please over to you, Manuela, Julia, and I'm just thinking, just a minute. Yes, so over to you.
Yes, so welcome. My name is Manuel. I'm a student at the ZHW, and I'm part of the International NGO Law and Policy Project. And New Women Connector was our client, and we were able to help them with their vaccination campaign.
Hello, my name is Julia. I'm also studying at the ZHW, and I'm also part of the INGO LPP project. And we have as a group the client New Women Connectors, and it was very kind and great to work with you together.
Hi, my name is Stephanie. I'm 22 years old, also from Switzerland, studying business law. And yes, I'm also in this project of this semester and supporting New Women Connectors.
Thank you, student. We also have Dr. Alexandra. I will ask her for her intervention after the presentation of students. So Manuela, Stephen, and Julia, so over to you. Please start your PowerPoint and your presentation. We're really looking forward what you have found out about the countries, how they are responding.
So before we start, we would kindly to point out that the research result we made about the vaccination is from the 14th May. So there might be a possibility that something has changed since then. And to start off, I would like to start with the UK. So as you can see, UK has together with Sweden one of the best practices about the vaccination strategies. So the UK has different vaccination strategies, so therefore the registration rules are different as well. So it depends in which region you are. So if you are in England, Wales, Northern Ireland, or Scotland. For the vaccination, you will be informed about when and where you get the vaccine. You can also book an appointment online at the pharmacies or at the vaccination centers. And also, therefore, the vaccination is for everyone, but it's only possible if you are in the specific risk group, which at the moment gets the vaccine. So you cannot register or book an appointment unless you're not in this group. Then the vaccination is free of charge and no documents are needed, which is a very good which is a positive point for migrants. And also a negative point is that the website is only in English, so this might be a difficult point, or this might be also difficult for migrants to get through the website and to find the needed information. And then an important point is that fact sheets are available in various languages. So what is the vaccination about and why do we have the vaccine or get the vaccine? And yes, then to show the population of the UK as of the 24th May is around 68 million people. And fully vaccinated is 1/3 of the population, and so it's kindly high. So the people who have received the first vaccination as of the 23rd May, sorry, are around 38 million, and the people who got the second vaccination are around 23 million people. So they are in a very good. They have a very good vaccination strategy, as you can see how fast they go with the vaccination.
Yes, so let's go to Sweden. Sweden is our second best practice country. As you can see, the only negative aspect of the Swedish handling of the coronavirus vaccination is that you will need documents, but you don't need to have the Swedish citizenship. You can have your asylum card, or if you just have applied for asylum in Sweden, you can bring the confirmation of the application and you can also get vaccinated. In Sweden, everybody which is 18 or older can get the vaccination, and the website is also in many different languages. They have a lot of fact sheets also in various languages, and they also have a strategy where people with high risk are vaccinated first, and an online registration is also available. Yes. And for the maybe numbers, Sweden as of the 21st May has about 10.1 million people living there, and fully vaccinated are 1.1 million. That's about 10%. It's not as high as in the UK, but they have a very good strategy, and also it is really good for migrants.
Okay, let's move on now with Denmark. So Denmark has also a vaccination strategy where people will get notified if it's their turn to get vaccinated or not, and they will be notified either by post or by email. The vaccination is free of charge, but there are documents needed. So it already starts if you want to book an appointment online, you need NemID. So NemID in Denmark is actually one secure login that is used for so many different things that you can do in Denmark. And they really want that you register with this login. So you can only register online if you have NemID, but there is still the possibility to get an appointment if you do not have NemID. But therefore, they have a list with different regions in Denmark. And there's also always a phone number, and you have to call the phone number that the region you're living in, and they will tell you what your process is looking like. The website of the Danish Health Authority is very, very good. It's very informative. They have a lot of information about COVID-19 in general and how it is in Denmark. But unfortunately, the website is only in English and in Danish. But on this website, you can find a lot of fact sheets, booklets, one-pagers, which are in many different languages. And also they created a Corona hotline in 12 different languages. So if you still have questions or just are unsure about something, you can call them. And obviously they have online registration.
Yes, so let's move on to Germany. Germany is a bit special in that way that each German region has its own procedure how to get the vaccination. So it's really hard to find a common ground. But in Germany, the vaccination is also free of charge, and they have different risk groups. And if you're, for example, situated in an asylum home, you are in the group number 2, so you can get vaccinated before all the people in Germany. Then they have an informative hotline and website, so it's a really short number, 6 digits, which you can call if you have questions, or the website is also filled with information. Then, unfortunately, the informations are mostly only available in English or German, but they do have some fact sheets regarding the vaccination, which come in, I think, about 20 different languages, and they do also online registration.
Then for Italy, so Italy is one of a few who do not have the best practice as Sweden and the UK. And the same as in UK, so the vaccine is for everyone, but it's only possible. So again, if you're in the specific risk group, which at that moment gets the vaccine, and so therefore they also have a vaccination strategy, and they follow this strategy. So in the end, that everyone gets the vaccine. For the vaccine, there is no charge, but you do need documents. So the documents needed are the identity card, the health card, and the tax code. There are different registration helplines per region. So if you do need any help or you do not know how to get further about the registration or about the vaccine, you can call them or go to the specific website. And just for information that it depends in which region you are. So therefore there are different registration rules as well. And then for Italy, the information on the website is only available in Italian and English. So this might be a negative point for migrants if they do not know the Italian language or English. Then another negative point for Italy is that they do not have any fact sheets available who may help the migrants to understand what the vaccine is about. So therefore, maybe they could put some fact sheets together to help them, or to help the migrants, as Italy is one of the countries who has many migrants. Yes.
Yes, so let's move on to Belgium. They also have a vaccination strategy and risk groups, and the vaccination is also free of charge. But unfortunately, you need an ID and confirmation for the vaccination appointment to get vaccinated. So that's negative. Then the website with all the information is not really informative, because most of the informations are only available in French. So if you don't speak French, you won't understand. Then they have some websites which are not only in French and English, but also in Dutch and in Flemish, which is a bit better, but can also be a problem if migrants don't know these languages. And unfortunately, there are no fact sheets available in different languages, only in those 4 languages. And in Belgium, you will get a letter, an email, or an SMS, which gives you the right to book an appointment to get vaccinated, so you can register online.
Then for Norway, here as well as the UK and Italy, the vaccine is for everyone, and it's only possible if you're in the specific group which get the vaccine at that moment. So you get also notified when you have to go to the vaccine, or when you get the vaccine and where. So they also have vaccine strategies with different risk groups. Furthermore, the vaccination is free of charge, but we do not have any data about if documents are needed. So we do not have any information about that point. One negative point with Norway is that the website, or they have no information available in Norwegian or English. So the website, the website is only in Norwegian or English and not in other various languages. So which might be as well difficult for migrants to get through the website and get their information which they need. And then another negative point is that there is no online registration available, because you get, as I said, contacted by your municipality or by your general practitioner, which you are registered.
Yeah, so Spain has also a vaccination strategy. So people will get notified from the health service when it's their turn to get vaccinated. The vaccination is free of charge, but there are documents needed, as you need a health card. And it is said that this health card is free for registered individuals and for individuals in special circumstances. So that might be pregnant women, minors, or those seeking international protection. The Spanish website is very informative, and the Spanish government website, unfortunately, is only in Spanish, but the one of the Ministry of Health, that is in many different languages. There are no fact sheets available in different languages. And about the online registration, at that time that we were researching, there was no data if this was possible or not. So about the Netherlands, they also have a vaccination strategy. So people will get notified if it's their turn by post or by email. The vaccination is also free of charge, but there are documents needed. So actually, when you have your appointment, you have to take the invitation with you and an identity card. The Netherlands has a very informative website, so they always keep it updated, so they're always updating it, but they do not have different fact sheets at all, so there are not even fact sheets only in Dutch. Another thing is that the website is only in English and the national language. And again, about the online registration, it was unclear or unknown if it was possible, because they said that if you want to book an appointment, you have to do it by phone, but they didn't mention any other options that you may have. So that was at that time when we're doing our researches. And about Greece, they also have a vaccination strategy, either people can check online or through message if they're eligible to get the vaccination. The vaccination is again free of charge, but there are documents needed. So for example, if you want to book your appointment online, you actually need TaxisNet, and TaxisNet is the online tax registration system in Greece. And besides that, you need an MCA number, which is the Greece Social Security number. But if you do not have the MCA, it is still possible to book an appointment at the CAP. So I hope I'm pronouncing this right, but the CAP is actually a citizen service center. And also you have like the possibility, if you have an MCA, you can go to a local pharmacy to book your appointment. The Greek authority, like the website of the Greek authority, is comparing to the other ones, not very informative. It is very minimalistic. And again, it is only like you only can translate it from Greek to English, but it is, if you translate it to English, there are still so many information that are still in the Greek writing. So you get less information if you translate it in English. There are no fact sheets at all, not even in Greek, but online registration is available.
Yes, so for the last slide, we just wanted to point out that actually the EU has directed sort of standards for the reception of applicants for international protection, which also covers the right to have health care, and that the people, that the migrants get the health care. So each member state should implement this directive, but it's not always done. And the EU also published an action plan for the next years. And with this action plan, they are promoting inclusion for all. And they also have a chapter which covers the health. So each individual or each migrant should have access to health and should know his or her rights in connection with health care services. So the EU has some plans and actions, but as we saw from the slide before, not each country is doing it the same. So thank you for listening to our presentation.
Thank you, Manuela, Stefan, and Julia, for your research, your work, which you are doing from last few months on a voluntary basis. It's mean a lot to us for our campaign, as we are a refugee and migrant-led initiative, and we are really thankful. But this important campaign, the important part, how we see that information is there and response coming from the different European countries is really needed. That's why I really request to Dr. Alexandra, who is your professor, your assistant professor, and I really want to see how, because you are teaching and your students are learning about the laws. So what do you think the implementation of this mapping exercise and actually how we feel more updated about vaccine situation going on in Europe? So what's your reflection and your learning while you are helping us out for this exercise?
So thank you so much for that introduction, and thank you to New Women Connectors for the opportunity for my students to work on this project. Thank you to the students for all your hard work. So I think that this project is really visionary, right? It's so important that we make sure that everyone has access to vaccines, whether you're stateless, whether you're sans-papier or undocumented, whether you're waiting for an asylum system decision, whether you've been ordered deported and you're waiting for deportation, right? It doesn't matter what your legal status is. It is essential for your own health, of course, the health of your loved ones and your community, and of course, the health of the societies in which you live, for everyone who needs the vaccine to have access to it. So we were so delighted to have the opportunity to work on this project. actually, I've seen some very interesting and important questions, which I think we actually need to address right now. And I think actually the questions themselves demonstrate the importance of the project. So let me just be clear, the students did their research current as of, I think, May 23rd, right? These are sophisticated students who put a lot of time into it. As you can hear, they speak beautiful English. They're aware of many of the other languages spoken in Europe. They have access to computers, they have time. They were assigned this project, right? So they did a great job. And yet, nonetheless, there's some ambiguity we see in the questions, for example, about the Netherlands. There's some questions about whether indeed you do need documentation. Is it available online? Is it available to undocumented people? I would like, if you wouldn't mind, Britt Kost, to make your comments. And I just want to say that if we have made an error, first of all, we'll correct it, of course, and put it on the website. But if we have made an error, the error itself is significant, right? Because if there's an ambiguity and my students, when doing this research in English, cannot find out the most updated, correct answer of what's happening in the Netherlands, that's a problem. That's on, forgive me, but that's on the Dutch government, right? You need to have information that's accessible, that's understandable, and that's current, right? So to the extent that there is an ambiguity, right, that means that the governments need to do a little bit better. And just one other thing, after Britt speaks, there was a question to the students about what exactly is meant by documentation. So maybe they can address that afterwards. But Britt, would you mind saying, not to put you on the spot, would you mind saying a few words?
That's okay. Thank you very much for giving me this opportunity to join this meeting. I will briefly introduce myself. My name is Britt Kos. I'm a medical doctor and a program officer at Doctors of the World Netherlands. And I work in the team who is addressing access to care to undocumented migrants. So my comments were not at all about the hard work all the students put in, because I know how difficult this can be. Not so long ago was a student myself with mapping exercises and everything. So thank you so much for your hard work. So for the Netherlands, for undocumented migrants, there is actually in the how do you say, the national infection group, I'm not sure the specific English words, they are taken into the strategy. And I was actually just looking it up, if I think it is actually just in Dutch about how it is, what the strategy entails. So that is what you said, Alexandra, a default in itself. So that's why it's always so difficult if you don't live in the country and are even not like working within this field. It's very hard to find the right information, because we get all these resources from multiple people who are only working in this area. So, but yeah, that's what my question was coming from, because no documentations, is that the same as not having a legal permit paper? Because a lot of people we work with do have documentations. They have their passport from their country of origin, but they don't have legal permit papers in the country of residence. But so for the Netherlands, people without legal permit papers will get access to vaccination, and we actually already vaccinated quite a few, also with the help of Doctors of the World, in cooperation with some of the GP practices.
Thank you. Thank you. Richi will give more answer in the end. So that's why we requested her to join. So there's more question coming, but in the end of the event. So yes, thank you.
Super. So one of the students, do you know the answer? It's okay if you don't, but do you know the answer to the question of whether the documentation means you can take your passport from your native country, or whether it means you would have to have immigration status?
Yes, so for us, documentation, and do the people have to bring any documents? This can be, for example, a confirmation letter, as in Belgium, that you are registered for the vaccination appointment, or for example, an ID. So it's any kind of documents. And as Julia said, in the UK, you really don't need anything. So you don't even need like a paper that says you have registered for the vaccination.
Super, super. So I'm so afraid that my students will need to leave to go study for their exams,
Yes.
but we will update this chart immediately. Thank you so much for the feedback. We will update it, and we'll also drop a footnote by how we define documentation. That's excellent feedback. Before the students leave, because they're the ones with the knowledge, not me, are there more questions on the specific chart? Okay.
I would just like to say something. I just wrote in the chat because, and to be honest, I was looking for it while you were speaking. I don't know, I couldn't find anything in Spain, but in Catalonia in particular, just as a region, there is access for people who don't have the tarjeta sanitaria, the sanitary card. And there is a way, there's a link, but it took me forever. While we were speaking, it took me forever to actually find it, and it's only available in Catalan or Spanish. And I couldn't find anything specific to Spain. It was only for Catalonia. So, I mean, like Brit says, sometimes also where you are impacts the information that you actually get. So I'll also probably try to find out more information about like how it is for Spain in general, and we'll let you know.
So thank you so much for that. And I know you want to move forward. I just want to say in concluding remarks, right, this isn't how it should be. It should be how it's done in the UK, or God forgive me for citing the US as a positive example, but how it is, frankly, in the US, where we're accustomed to providing healthcare in a different way to folks who are without papers, right? It should be that there's a giant tent and you show up, right? And they say, we're happy to see you, here's your vaccine. That's how it should be. Of course, the doctors can speak more about the details, but it should not be that we're having disagreements about who exactly needs what paper in what language, right? This is absurd. The UK has set a great example. Good job, UK. And there's no reason that all the countries of Europe shouldn't move towards that best practices. So again, thank you so much for this opportunity, and thank you to all.
Thank you so much. Thank you, students. Thank you, Dr. Alexandra. It's really a privilege, and we keep continuing our collaboration. Thank you so much for joining us. Okay, viewers. So now we go to our second part, which is about all for vaccine. What does it mean? It means we are from migrant backgrounds. We do have some kind of question, and this is our right to have the answer to those questions. Therefore, we invited different leaders from Italy, from Spain. Myself, I'm from Netherlands, but we also have a few people from Norway and Denmark who are the community leaders, and they are a direct contact with the community when they are having a conversation with them. There is some kind of hesitation, which we do understand. They have the right, because this COVID is new for us, and this situation is new for us. So that's why we really need to have the answers of our questions. So before giving the introduction to our second panel, I will show our video, a message from a very good collaborator, Sagar, who's actually a refugee from the stateless background from the Kuwait. He recorded his message, and he really wants to part in this debate, and I will share my screen so you can hear what he's saying. So just give me 1 minute so I can share my screen and you can hear his voice.
Hello, everyone. My name is Sagar. I am a practicing doctor in Bulgaria. I'm also a refugee with a humanitarian status. I am also stateless, born and raised in Kuwait. from a stateless father and a stateless grandfather. Regarding the vaccination, specifically for migrants in the refugee community, I've had certain people from both communities, whether it's the host society or migrants from different refugee backgrounds, asking about the availability of vaccines, whether it's possible for them to get it, whether it's safe for them, whether it's not safe, and the policy of the country in general regarding vaccination as a concept, the safety of it, and as its availability for the community. And including myself, it is always tricky to answer these questions without being backed up by the government itself, by the institutions. And if we just read into the questions that I have received, and some questionnaires, because we've received feedback from different backgrounds, and so a certain background doesn't have a problem with getting vaccinated. They believe it's the way to go, and it's just that they are not sure whether they can acquire the vaccines, and the how and the when and the means. On the other side, you get a background in a certain community being reluctant to receiving vaccination, whether it's available or not, it does not matter. It's just that they have, the very known, theory about vaccines being bad for you and bad for your health. Now, we're not going to get into that, whether vaccination is good or not good. It's just that the difference between the two ideas and the two thoughts in the very same environment, they're all refugees coming from different backgrounds, hanging out with just different ethnicities and different backgrounds, and each come up with their own method or mean to deal with the COVID situation. And this leads us to knowing the concrete fact, which is if a community or a society comes up with its own methods, comes up with its own means of tolerating or accepting or not accepting a certain thing, this means that there isn't a coverage, there isn't enough information provided to this community by the government itself. The institution that is subjected to be questioned about these things, the institution that has to provide for everyone residing within the borders, because safety and health is not for citizens only. It's a disease doesn't know a citizen from a migrant, from a foreigner, from a refugee, from a humanitarian status person holder, or a stateless person. So it's a general procedure. Weirdly enough, that we are not receiving, even myself as a doctor, it's very hard to locate a channel of information, because every TV channel provides its own view. Every station interviews a certain member of the government that speaks their own idea and their own opinion about the matter, and how to counter certain problems and obstacles that we are facing.
So yes, so that's first recorded message which I really want to share with all of you to start warm up the discussion why we are trying to create a solidarity from migrant communities, for especially for migrant communities, how they have different kind of difficulty accepting this vaccine. So we have a very good panel here today. I have Said Hasnan, who is joining us from Italy, and we have Asif, who is joining us from Sweden and Denmark, and we have Rezan, who is joining us from Spain. So I will start with Sayed. But would you give us the perspective you are hearing, the conversation you are hearing from the migrants? Are they accepting it, or there's some kind of doubt among them, and how you are tackling in it regarding this situation? So over to you.
Thank you very much, Anila, for this opportunity and for invitation. So I'm president of UNIRE. I'm also a refugee from Afghanistan. UNIRE is Italian National Union of Refugees and Exiles. So regarding the pandemic and also the vaccination in Italy, unfortunately, when the pandemic started and there was unfortunately lack of access to migrants, especially because previous to pandemic there was a reform of the law from Salvini government, which was called Salvini decree. So this decree produced a lot of caused illegal migrants, because many newcomers, when they arrived in Italy, due to this decree, they had not the right to get regularized and to be to work, to start working and to be integrated in Italian society. And unfortunately, then started the pandemic. So there were a lot of people that they do not have any access to reception centers because they were homeless due to this Salvini decree. And also another problem that was caused due to pandemic was the access to information, because obviously we know that this was an emergency situation. So the people, especially migrants living in Italy, asylum seekers, refugees, they had not opportunity to get informed on their own languages. And it was quite complicated because everything was happening, but there was not information in maybe in Farsi language, in Arabic language, in French language for asylum seekers and refugees. So it made also more complicated for the people in order to face the pandemic situation. And if we speak about the vaccination in Italy now, there are around 500,000 migrants that they are in the risk of not getting the vaccination because they are excluded from the program. For example, if there is a migrant, and for this reason, it is very important to give access to all migrants to be part of society, and also to have access to all kind of the rights. For example, the health, the access to the health facilities and services. So there are like many migrants in Italy. We have the problem of labor exploitation. So especially in agriculture sector. So these workers, they are living in informal settlements, and they do not have information in their own languages. They do not have access to health system, so they do not have insurance, and this makes complicated. For example, if I don't speak the language, and if there is not any possibility to book the vaccination appointment for myself, then it is a problem, and this is because of exclusion of the many minorities. And one more thing, that in some regions in Italy, they started to give possibility to migrants, especially to homeless people. I speak about the Lombardy region in the north. So they wanted to vaccine also migrants and homeless people. And then again, there was from far right parties some instrumentalization of this campaign, because they said that we are Italian citizens, we do not get vaccination, but they are like illegal migrants, they have the opportunity to be to get vaccinated. So again, they are they have more rights for us. But it doesn't mean that if any minority, especially homeless people, that they do not speak language, they do not have access to accommodation, to shelter, they do not have access to information on their own languages. It doesn't mean if we exclude them, then it means that we somehow guarantee more rights to Italians. No, it is the cause of general health, the health of society. So we give, if we guarantee vaccination for all, for every human being, then it means that generally we will be more successful to face this pandemic. And luckily, regarding some positive examples related to migrant communities in giving access to their members, UNIRE with its member organization, they worked in providing information in different languages when the pandemic started. But we need to start also this work on vaccination, because people, they have also concern about the use of vaccination. As you said also, Anita, in the beginning, that we refugees, we migrants, we would like to know if this is the right vaccine, which is the right vaccine, and if it is positive, if it is healthy for my health. So for this reason, if we provide the information, the vaccination campaign will be more successful and will go smooth. Thank you.
Thank you. Thank you. So I will turn to Asif. Asif, you are joining us from, you are sitting in Denmark and Sweden, Malmo. So you are from South Asian communities representative. So I would like to say how you see the communication which you are having in the communities based there, especially coming from Pakistan or Afghanistan or others who have this kind of some kind of doubts or some kind of hesitation in accepting this vaccine. So how you are tackling, and what kind of requirement or information do you think we need to generate?
Thank you very much, Anita, to provide me the opportunity to share my opinion about the vaccine happening in Sweden and Denmark. Since I'm based in Malmo, which is very close to Denmark, so I have kind of information about both the countries. I will introduce myself. My name is Asif Khan, and I'm founder of Center for Capacity Building and Empowerment. With that, with few other friends who are already here. So we are also core team member of European Coalition, which is also extensively working on refugees and migrants. My experience so far looking at the scenario is that Sweden was having a different kind of policy comparatively to other European states, and the reason was that it was looking for something different. UK was somehow following it initially, but still, apart from that, it went to another step and it went away from the policy, and Sweden was the only country that was mostly following this kind of policy, not to have strict restrictions on the on the Swedish residents and nationals. So we were not having masks, we were not having some kind of restrictions to be together, or then later on with the change of time, and there was different kind of restrictions. Now the current situation is that in a gathering there can be 8 people maximum, not more than that. But there are different kind of restrictions. For example, in public places, it is a 5-meter distance rule applied. So totally it is different. Now that when the vaccination started in Sweden, as well as in Denmark and Norway, there was one vaccine that was not really effective, and people had a lot of concern about that because there were some deaths taking place. And the government of Sweden and Norway stopped that vaccination at that time. And especially after some time, the vaccine was reintroduced and reused again because the death was not being the cause of vaccination. So when it was clarified in Sweden, but Norway took a bit longer time, and it still carry on with the restrictions of that very vaccine. About Denmark, it is always conscious about the vaccine chosen, which they chose, and their policy is also going very effective so far. So the statistics for all the three countries, Sweden, Norway, and Denmark, is going very similar to each other till now. And right now in Sweden, we have like the group that is 50 to 59 been vaccinated. So probably this month or by the end of this month, this group will complete. The group that was above 60, they are already done in Sweden, and as well as in Denmark and Norway. Besides that, the health workers and the special people like teachers in some areas are also vaccinated. So there is no policy that who is migrant or not migrant or refugee, or this is not kind of concern in these three Scandinavian countries. We are getting vaccinated upon the age group. So there are two, as I said, that their normal age group which is vaccinated right now is 50 to 59. But also the special people who are having special kind of diseases also that are termed as very sensitive. So they are also getting vaccination before the normal age groups. The vaccination process, which public opinion is having, is that it is quite slow, and comparatively when we see the examples of US and UK, and the immigrants and refugees who are living in these countries were having a lot of concern about the vaccine itself, because it was not only concern with the refugees and immigrants, but also the nationals here, because it was not showing the effects, or it was having some kind of reactions to the population, which was concerning people a lot. And since the refugees and immigrants who are living in these countries are traveling to their home countries and other countries a lot, so they get these variants from other countries, especially the current variant, which is the Indian variant, has entered Denmark, and it is here that Sweden is also having this variant already, which makes the population more concerned and more worried that, okay, if the variant is not having an effect from the vaccine, then it can affect what is the use of having the vaccine then. So there are double kind of situations that people are not really sure that they should get vaccination or not. But initially it was very, very high that people were looking for other example, and if someone else is vaccinated, they were having questions from each other, and okay, when they were satisfied, then they take the vaccine. But it is voluntarily, it is free of cost, and depending upon who wants to take it and who don't want to take it. But like the refugees and migrants groups have been taken in a good way, and they are not discriminated or in any kind of way that they don't feel good about the vaccination. Now, like they have similar kind of feelings with the nationals. So I think I should not take more time, and thank you very much for your time.
Thank you, Asif. Thank you so much for joining us. Okay, now Rezan, you are joining us from Spain, and you are also from a background from Syrian migrant and a woman. So I would like to ask you a question again, which I asked Sayed and Asif, but I really want to go in detail. The reaction coming from the communities, what you hear, how we need to talk about, because I'm also from Pakistani background, and even in Pakistan here, our communities, they are saying, is it halal or not? Should we take it or not? What would be the reaction? We do know these are the questions genuine, but how we need to tackle it to continue this discussion. So over to you, and share your comments about it.
Thank you, Anila. So basically, I mean, in Spain, we're in the same, I think, the same boat as Sweden. So there is a massive problem here in terms of information, and lack of information. Not only that, we also have, because I'm from a Syrian background, obviously, in Syria in particular as well. So when we talk to our parents, to our families, to our friends in Syria, we have very mixed feelings and very mixed emotions about it, and very mixed information, even because there's no access to proper information. So I think there is a mixed feelings about whether we take the vaccine or not, and I think there's a lot of misconceptions about so especially for people who were saying, so I heard people saying that, okay, well, I'm healthy, if I'm not in contact with older people, then I'm not going to take it. And it might have been from a point of, or from a point of view of, okay, well, I'm healthy, so I'm not going to take somebody else's dose, for example. However, they didn't know, and I think it's just the lack of information, especially in our language, and in general, in fact, that, for example, it does reduce the infection rate. So there's a problem with information and access to information, which makes the feelings and reactions mixed. So there's a lot of people, and most of the people that I know are quite young. The reaction from women is more positive than from men in general, and from the people I know. And to be honest, I do think that there's definitely a lack of information on what to do, how to get it, why, whether it's good or not, which ones that we're actually getting here. So obviously, because of everything that was happening with AstraZeneca and the and pulling of the vaccine, and you know, which age group is the correct one, we still don't have like proper access to this information here. So that's causing a bit of a mixed feeling and mixed reaction from the community here, especially when they talk to the family and to the friends. Back in Syria, for example, they still have also mixed feelings, and I think the main thing is the lack of information. So, for example, while we're talking, I was looking for the information. It was all in Spanish or in Catalan, for example, for people here in Catalonia, and I didn't even know some of the information that was there. So access is a massive problem, and I think that is causing the community to react in a kind of varied way. So maybe it is a call to, you know, to provide the information. Obviously, this is why the campaign is very important. It's because it's up to us as community leaders. And to be honest, I would have thought that they would reach out to us, for example. I don't know, maybe not to us, to the community leaders, to actually provide the information or to reach the community. To actually provide the right information in the right channels, but none of that happened, and I don't think it is going to happen. So we're probably going to have to take initiative ourselves and provide the information ourselves, and it's probably going to be our responsibility.
Thank you, Rezan. Thank you. Yes, indeed. That's why this is the main reason we take it. How to join this impact about tackling with the COVID, and we are the community leader who joined to launch this campaign. And this is starting our work, because it's going to take 1 year, 2 years, or maybe a few more years, how we come out and take our life back in our hands, which we can call it a normal life. So now we have our last guest, Richi from the Doctors of the Borders. If I'm pronouncing it wrong, apologies.
Doctors of the World,
so,
yes.
Doctor of the World, yes, sorry. So we really like to hear our both perspective of how states are reacting and how communities are reacting. So what's your standpoint and how you are thinking, because you are working very intensively in this field. So please take the floor and share your feedback.
Yes, thank you very much for inviting me. Like I said, I'm a medical doctor at Doctors of the World, and we offer support for undocumented migrants in the Netherlands, mainly focused in Amsterdam and The Hague. And so what is the situation in the Netherlands is that it was quite clear from an early stage that all undocumented migrants would receive a vaccination if they wanted to. The only thing is that the how, the when, the what is still sometimes a little bit unclear. At the moment in Amsterdam, they are distributing the vaccination for the people in the shelters, so also the homeless Dutch people, but also the people, the undocumented migrants who live in the shelter. So that's their starting point, which I think that Netherlands is quite pragmatic in that. First, vaccinated people you can find the easiest in this very hard to reach group. And I think in a public health perspective, this is the way to go, because you need to find as much people as quickly as possible. So if you try to reach the most difficult to find persons first, of course, like from an individual perspective, that is very important, but from a more public health perspective, I think that's a quite pragmatic approach. I think we're as the Netherlands, we're quite known for our pragmatic approaches. So they are started first, and also it's really regional differences. So the municipalities from each city will have their own strategy. And in that way, they can like really customize it to the unique situation in every city of which undocumented migrants live in. That also can make it a bit more, give it a bit more time before everybody will be vaccinated. But for now, they're really reaching out to all the migrant organizations like Doctors of the World, who have the direct connection with the people they want to find. Some organization already started to initiate registration, so where people can only leave their name and phone number, so they don't have to give any more personal details, because of a lot of the undocumented migrants have the fear that all their personal details will be scattered around with the government. So it's very just your name and telephone number, so the people from the migrant organization, when they have more information from the government, can call the migrants. This is, of course, one way to find them, because this will give not the complete overview of all the migrants. But to just make a quick sidestep, it's also quite a unique situation to find out actually how many undocumented migrants we have in the Netherlands, because we have no idea. So, and of course, not everybody would want to get vaccinated, but it might actually also give us more perspective on how many undocumented migrants we actually don't provide care at the moment, but we will be reached. So that's maybe some limelight of this very terrible corona crisis, to gain more access to undocumented migrants. And for now, people who are in the Netherlands, just Dutch and documented, the cohort is now, I think, 1917 and before, so born in 1970 and before, and also undocumented migrants can already call for an appointment. The barriers in this is, of course, that the people at the call centers don't always know that also undocumented migrants can get the vaccinations. And they are, of course, only available in Dutch and English. So concerning the information spread, that can really be a difficulty. At the local call centers, so from the municipalities themselves, they are much more informed about that. So that's why I think the local approach of the Netherlands is, for undocumented migrants, a good situation.
Thank you.
I'm not sure what to tell you.
Thank you so much. We already so excited to have you, because today is just starting. As I said, this is the launch of our campaign, and we are just making sure we show to ask the governments, but also ask the community how we can create our work together. I just want to see there are very good allies in the participant list if they want to take the floor and to share their reflection, because it's an open call to join this campaign, open call to join this initiative. So if anyone like to have any question, any reaction, to give any kind of feedback or suggestions, so you can raise your hand. And if you have any question for the few audience which we have in our webinar today, so anyone would like to ask any question or any feedback? I'm just checking if we have any hand raised. No, okay. So I just then want to say thank you to all of you for joining. And as I said, we launched this campaign today, and we really want to make sure to have to make sure everyone is getting vaccine, but also if any communities, anyone from refugee, diaspora, stateless, other refugee background, asylum seeker have some question, some doubt, they talk about it. They have their languages accessed in their mother tongue. They have the information, and they know why it is important for this. So thank you so much for joining us, and stay in touch. And we have launched our campaign page as well. And okay, I just saw okay, Chris, thank you so much for your message. And but as I said, we can have a further debate in our future events. We want to have more debates and more events. So thank you so much. Stay connected and stay tuned. Thank you. Bye.
Thank you, everyone.